Hey guys, Katie here. I want to do a video of my health concerns as of right now while I'm still pre-surgery. I'll just say where I am now, and then maybe like a couple months from now, or a couple months after the surgery, maybe we can talk about this again and see if any of these health things have gotten better. I kind of want to give I'm in the bathroom and my fan is going on. So hopefully you guys can't hear that. My hair is now black and I got some colored extension highlight things in there. Kind of loving it. I have, on my phone, I have my list of health concerns. Okay, so one thing that kind of threw my whole life, it brought me down to this. I wasn't really that big. I mean, I was big. I was always skinny. Let me just start off in the beginning. I wasn't large my whole life. I was always between 110 and 115 pounds. I'm 5'5". I used to actually think I was really fat. I have an older brother. He used to always call me Thunder Thighs, and he always made me feel fat, even though I was literally like 110 pounds. And I always felt really fat, and I had really bad self-esteem, and I would wear like big sweatshirts and stuff. I did always have a large chest too, so I feel like I always got attention. Like guys would always comment on the size of my chest, so I feel like I was always kind of like covering up for that reason too. And then I want to say, like, once I got fat, I kind of felt better about myself. Not better about myself, but it's like, I'm fat, you can see I'm fat. Like, I didn't cover up as much. Not that I didn't cover up, but I would literally, like, wear sweatshirts when I was skinny because I didn't like people seeing, like, you know, the vroom, like, you know, my curves. Like, I don't know. I just didn't, people would make comments, and they don't make comments when you're big and fat. Yeah, I got big boobs, but I'm big everywhere. So, like, that's a given. Okay, so I think I was like 22 years old and I moved out of my mom's house and I got a desk job. So 40 hours a week sitting on my ass got fat. I gained like 70 pounds in 1 year. They did all these tests and I was just fat. There's no thyroid, no nothing, I was just fat. And I've slowly gained since then, and then kids didn't help. When I get pregnant, I get something called hyperemesis gravidarum. A lot of people don't know what that is. Princess Kate, she had it. Kelly Clarkson, whatever her name is, she gets it. I think it's like either 2% of the population or 0.2% of the population get it. Some people think it's like morning sickness. It is morning sickness on fucking crack. Like, I can't eat anything, and I have it the entire pregnancy. This last time, it was really bad. I was with my little boy. He is like 2.5 right now. I was on IVs because I couldn't eat anything. I couldn't drink anything. I puked all the time. Every single day with both pregnancies, every single day I threw up. So I have to be on IVs and I lose a lot. With my little girl, I lost 25 pounds while pregnant. That means 25 pounds, and then you get all like the gushy baby stuff has to be at least like, what, 15 pounds? So 25, 35, that's 40 pounds I lost while pregnant. That's not good. So the problem is when you lose all that weight, and then when you can eat again, like boom, your metabolism is totally messed up. So you just get fat because your body's not used to taking in, you know, your body's in starvation mode. So it just stores that fat because it wants to store because it's used to being starved. So I got fat, and I did go on Weight Watchers and I lost like 50 some pounds, and I was down to 190, I think. And I felt really good. I was out of plus size. Like, I felt really good about myself. And then I had to work really hard though. And then when I went to school to finish up my like medical classes, I had to take lab classes, and looking under the microscope and stuff, like I couldn't focus on, the schoolwork was so intense. I couldn't focus on that and focus on dieting and counting calories and points with Weight Watchers, blah, blah, blah. I tried Nutrisystem thinking that would be easy. No, I couldn't focus on anything but schoolwork. I got straight A's. I was on the dean's list. I was really proud of myself. But, yeah, I gained all my weight back. So that sucked. And then I got pregnant with my little boy. Like, I tried. I didn't got pregnant. So with him, I lost 37 pounds. And then again, with all like the gunk in the belly and stuff. And the weight of the baby was like 9 pounds. So, I mean, I lost a lot of fucking weight with him. And that one was really bad. I couldn't get off of the couch. Like, I couldn't move. I couldn't read a book. I was just laying there like a zombie, like dead on the couch. I had a home nurse that had to take care of me. I couldn't take care of myself. I couldn't take a shower or do anything. I lost so many friends like with that because people just give up on you. Like after like 9 months of like you saying like, I'm sorry, I can't. And then everybody tells you like, oh, I had morning sickness too. It's not morning sickness. So, I was getting kidney failure and stuff with him, and like, we both could have died. It was bad. I was blacking out from just being so dehydrated. Like I would pass out all the time. It was really rough. So anyways, when I could finally eat again with him, the weight came on so fast, and I actually I got real sick after him. Well, I was sick while I was pregnant with him, obviously. So let me pull up my list here. After my daughter, I got restless leg syndrome. I mean, that's tolerable. I got it while I was pregnant, and the doctor said that'll go away. It didn't go away. It just got worse and worse. So I actually take Parkinson's disease pills for that, and I have to take more and more all the time. The doctor says I'll have it the rest of my life. Whatever. That just sucks. It's just part of life now. So now after my boy, I got fibromyalgia. And the doctor said that how you get that is most of the time you get it after a traumatic event. And she said my traumatic event is my son. So I have fibromyalgia. I'm in pain all the time. And I have no energy. And that is making me more fat, obviously. There goes my fan again. I hope you can't hear it. And then I'm on Lyrica for that. And that makes you gain weight. So it's like, great. So now I gain weight from my medicine, and then I gain weight because I have no energy from having fibromyalgia. So I have to do something, or I will be on like TV, like TLC for like my 600-pound wife or something like that. I need to do something now before it's too late and I get too big. So another thing I'm looking at my list here is an autoimmune disorder. All my labs and everything, all my blood tests were terrible. I have a lot of, what is that word I'm thinking of? Inflammation, obviously, because I'm in constant fucking pain. But the doctor said it's pretty certain that I have an autoimmune disorder, and it's something beyond fibromyalgia. And I didn't even know there was such thing as a lupus rash, but I have a lupus rash that develops quite frequently. So she actually sent me to a dermatologist to have a biopsy on it. And of course it cleared up right before I went to see her. It didn't clear up. I still had like the reminiscent. For me, it looks like I get shot with a paintball gun afterwards. I have like red blotches all over. But she said she can't biopsy that. It has to be while it's like, whatever. So she looked at my stuff, and she said, you absolutely have an autoimmune disorder. You need to go see a rheumatologist now. They can get you help. And she's pretty certain that I have lupus. I did the, what is it, the R1? I don't know. Whatever the test is to see if you have... Do you guys just hear that? I forgot that my phone is hooked up to a speaker in here, and my phone makes a T-Rex roar when I get a text message, because my little boy loves it. So yeah, sorry about that. So yeah, the test for lupus that my doctor did, it came up negative. Maybe it's A1, I don't know. It's something, I can't think right now. But she said that only 40% of the population actually shows up on that test. Like 40% of lupus patients show up. So my dermatologist is quite certain that I have lupus, especially because I have a lupus-looking rash. But I haven't gone to the doctor, and it's been like a year. And I mean, I go for fibromyalgia, and I go for those medicines and stuff. And she keeps saying like, have you gone to see the rheumatologist yet? And she gave me another referral to go see him. And I just never do it because I'm the kind of person that you just set things aside because you just don't want to deal with it. So I know it's not good. I know. I talked to my surgeon about it, and she said that if you do have an autoimmune disorder, let her know. And she said the basic thing with having an autoimmune disorder is between the 3 surgeries, the lap band, the sleeve, and the gastric bypass. She said she would recommend the sleeve surgery so that you can take your medicine easily and you don't have to crush or whatever. And she said, since you are doing the sleeve, like it's not gonna be a big deal. She said just let her know so that they can put it in their files. So yes, and then I had to go see a psychologist for some fibromyalgia shit that goes on. I'm really forgetful. Like, I forget everything. And I know people say like, oh, with old age, blah, 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 you forget. No, I forget everything all the time. I'm 34 years old. I shouldn't be forgetting this much. And, yeah, so I had to do a bunch of tests and stuff. And I was diagnosed with short-term memory loss, which won't get better, which is horrific. And then chronic pain anxiety, which, I do notice it, like, when I talk to management at work, like supervisors, I just get really cluster-minded. My mind gets really clustered and I just can't focus, and I just walk around like, don't say anything stupid, don't say anything stupid. And then like the stupidest fucking thing comes out of my mouth when I talk to them. It's not with everybody, it's just basically supervisors, people of authority, I guess. I don't know. It is what it is. It's not, I don't know, it's not that bad. The short-term memory loss really sucks. I have to leave notes for myself everywhere I go, like the note I just left here. My surgeon said that fibromyalgia can get better with surgery. She said she almost didn't want to say it because if it doesn't, she doesn't want patients to count on it getting better. But she said it very likely can, you know. So I think, like, you know, if I don't have an extra 100 pounds that I'm carrying around, how can it not get better? But we'll see, I guess. I think that's all I have right now. I would love to hear if anybody ever had hyperemesis gravidarum, HG for short. I would love to hear from you. It's a traumatic thing to go through. And if anybody's going through it right now, send me a message or something, or email or something. And I don't know, we can talk about it. Some things that I went through. I mean, I went through it with 2 pregnancies. My entire pregnancy with my little boy, I actually went like a week over, so it was like 41 weeks of hell. So yeah, I will keep you guys updated on the appointments and stuff. And I just want my fucking schedule. No, I want my appointment, like my actual surgery, I want it in the books. We're planning on doing a family water park resort trip in like first week of March, and it would just be nice. I think you can't be underwater. You can't go underwater for, I think it's a month. So it'd be nice to know, like, am I gonna have to schedule it after, like, because I'm sure I'm not gonna get it like within a couple of weeks. So I don't know. We'll just see how it goes. Hopefully, I just want it in the books, so I know what to look forward to. I actually had to go clothes shopping today for some work clothes, which I really didn't want to do. I've been putting it off, but I have to wear solid black. I do makeup and at Kohl's, like, hey, makeup. What the hell is? Oh, I hate that I can't think of her. I can't even think of a beauty advisor. That's my job title. How can I not know that? I've been there for almost a year. Beauty advisor, makeup artist kind of stuff, and I have to wear all black, and my clothes just get so dirty and stuff. I just get covered in makeup and makeup removers, and my clothes get really gross. So yeah, I was gonna tell you, I have a beauty channel that I started, which I will put below if you want to check it out. I'm gonna post my 2015 beauty products soon, my favorites. But I'm gonna do a lot of, like, I sweat a lot. I don't know if you can see how shiny. I'm not sweating right now, but I get really sweaty. So I have like a lot of beauty products that I use for, to keep me matte from being sweaty. People who get shiny, you know, just different things like that. How to contour to give you the sleeker look. Contour, get rid of the double chin. Obviously, I didn't do it right now. You know, just some tips and stuff for, I don't know, for bigger people, hair tips, like hairstyles. I don't know. So check out my beauty channel. It is, I think it's Katie Quick or something like that. I'll post it below. Thanks for watching, guys. Thumbs up if you liked this video. Subscribe below if you want to follow me in this journey. Thanks for watching, guys. Bye.